I would be presenting the topic of human skeletal system, and we will be discussing about the different type of bones, different type of joints in the body, function of the bones, different functions of the joints of different types, and the associated different diseases of any age. So let's begin with the bones. Can everyone see my screen? Okay. Bone is one third connective tissue. What does it means? We have different type of connective tissues. We have different type of body organs, body organ systems. Like we have blood, we have bones, we have muscles, we have different organs, we have brain, we have spinal cord. These are different type of tissues. So bone is one type of connective tissue that basically supports our body in different ways, mechanically as well as biochemically. So bones are made up of calcium and some other salts of calcium. So when we grow from the state of like childhood to the adulthood, our bones are pretty soft and like cartilaginous, sort of like I would say immature bones, but as we grow, they become more rigid and bigger in size, more tougher in strength. So what does happen why does this process happens, and how does it happen? So we're going to talk about in great detail here. So bones are made up of calcium, plus there is connective tissue, which means there is not just minerals, plus there is more to it. Like there is collagen fibers, which are protein, and proteins are like very tough and resilient. They are flexible. So depending on the function of the bone, depending on the presence of the tissue and the location of the tissue, so there are specific functions of each tissue. So there are 206 bones in human skeleton, which does not include teeth and sesamoid bones. Small bones are found in the cartilage. So what there are basically 206 bones, 206 bones in an adult human body, whereas in children there are more than 206. They become fused and when you reach the adulthood, eventually you have 206 bones, which does not include teeth. Teeth are also kind of bones. And there are sesamoid bones. Sesamoid bones means there are bones that are present within our muscle or cartilage, like our patella, our knee bone, in front of our knee joint. That is called sesamoid bone. That bone is present in the soft tissue of the body. So uh, moving on with the further classification of the bones, there are 80 axial bones, whereas 126 pendicular bones. Axial bones means the bones which make axis of the human skeleton, which means our skull, our spinal cord, our ribs, our sternum. Sternum is the bone that is present between the ribs of our body. Next is the appendicular bones. Appendicular bones are basically our forearm, our upper arm, our legs, our lower legs, our hands, our toes. Everything that make appendages of our body, which means extension from the central part of the body, like our arms, our legs, our feet, our hands, that are included in appendicular skeleton of human body. So axial bones include head, facial bone, hyoid bone, auditory trunk, ribs, and sternum. These are different type of like bones, but you don't have to remember all the names. Just have the at least have the idea of what axial skeleton is and what appendicular skeleton is, and what is are the total number of the bones in our body. So these are a whole lump sum of the bones. You don't have again, you don't have to remember all of it, but just let's just have an quick overview of that. This is our skull, this is our spinal cord, sorry, spinal vertebral column, this one, and these are our ribs. This is sternum. These are our upper arm bones. These are forearm, the hands. Then there are our hip bones. Then our leg. Then lower legs. then feet. So this is how bones are organized. Basically, bones, if there is no joint in the body, there wouldn't be any significant function of the bones. So this whole structure, this bit organized and more sort of categorized system of our body of the like humans, these bones are sorted with the help of joints. And when in like infant stage or in fetus stage, before birth or after birth, like few early years of life, our bones are quite soft. And you can see the babies can like literally bend their arms, and they don't have any issue with that, which means they are very flexible. But as we grow, the bones become more rigid, the joints become more specific, and we only have like specific movements with each joint. Let's move forward with the function of the bones now. Okay. The main function of the bone is to give shape and support to our body. That's understood. But there is more to it. Like they provide surface for the attachment of muscles, tendons, and ligaments. For example, this is our like humerus. This bone is called humerus. Uh, as we know, this supports our like arm. Okay, then there is more to it. All type of muscles, like we have biceps or triceps. Some people go to gym, like they have more developed, they have well developed muscles. All those muscles are attached to the bones. Like bicep is attached here and then here. And if we bend our like elbow joint, that muscle pulls the elbow like this. So this is how mechanics of our bones work. So they serve the muscles serve as levers. Like one attachment is here. This bone remains in the same position, but the other attachment of muscle is, for example, here. Let me put a marker here. For example, the first attachment of the muscle is here, the next one is here. So when the muscle contracts, it is understood that this bone will be pulled like bent or like flexed towards this bone. So this is how muscles serve as a function of the lever. So next is skull, vertebral column, thoracic cage protects brain, spinal cord, thoracic viscera, respectively. So some of the bones act as cavities, like skull act as cavity for the skull, it protects it. Then there is rib cage that protects our lungs. Then there is pelvis, which protects our urinary bladder and other female reproductive organs in case of female. And then there is abdomen, which is surrounded by like slightly by the bones, but also guarded by the muscles. So all our other viscera are located here. Also, our liver is protected by the rib cage on the right side of our body. So there are different functions. We started with the shape and support. Then we move forward with the attachment of muscles, function as a lever. Then we discuss that they can act as protective cavities. Then there is more to it. Bone. There is, for example, in the long bones, as you might have seen, like if you cut a bone, then there is a solid part, this one, and then there is a cavity. This yellow part is called a bone marrow. So basically, what is the function of bone marrow? Bone marrow like manufactures blood cells of all types, and plus there is more to it. Besides bone marrow, this sponge-like part of the bone stores and releases fats as well. Plus there is all kind of minerals like calcium. Extra calcium is also stored in the bones. So it protects internal organs, stores and releases fats, produces blood cells, stores and releases minerals whenever required, facilitates movement, supports the body. So these are all the different functions of the bones. Then there are also we have nasal and paranasal sinuses, like they are located here on the face, in the bone. They are basically like small cavities in the bones that allow air to circulate in, and that also makes our skull a bit lighter than it usually should be. So when you make a bone hollow, it becomes lighter in weight. So these cavities act as sinuses for the airs to circulate whenever we breathe in and breathe out. So these were the different functions of the bones. Next is the classification of bones according to the shape. Then there is the classification of bones on the basis of like development. But for simplicity, to make it simple, I have classified according to the shape. So there are long bones, there are short bones, there are flat bones, irregular bones, pneumatic bones. As I said, bones have like small cavities for the air. Those are called sorry pneumatic bones. Then there are sesamide bones. Sesamide bones are bones that develop within a muscle or soft tissue. Then there are accessory bones. They are sometimes present, and there's mostly they're not present, but they can be present in some people. So long bones are, you can imagine all the long bones in our body, like our upper arm, our forearm, our legs, they all are categorized into long bones. Then there are short bones, like we have bones in the wrist, we have bones like in our palm, we have the bones in our fingers, those are short bones. Then comes the flat bones. Flat bones are basically plate-like structures. Like they're not flat like a stick, like, but they are more like flat. This like our hand, like this one. So where does they present? Where are they present? They are present in our skull, in our ribs. Sternum is also a flat bone. Their scapula, our shoulder bone, is also a flat bone. So then irregular bones, vertebra are irregular bones, pneumatic bones. Pneumatic bones means they have air sinuses, which means our maxilla. This bone is called maxilla, and all some other facial bones have also uh, air sinuses as well. So which makes like lighter in weight, help in resonance of sound, and act as air conditioner chambers of inspired air. So basically, what is the function of pneumatic bones? They we let in air. They help in circulate like this in the sinuses. So what difference it make? It makes the air like it makes the temperature of the air that we inhaled equal to the our body temperature, so we don't have like we don't get like cold or other infections. Other than, for example, in adult people, we don't usually get as much as infections as the children get. This is because of their like weak immune system, as because they are growing, and in adult people they are already grown up, they don't get many infections. But if there is some sort of issue with this air conditioning system, if our sinuses get infected, they definitely get a great deal of discomfort. We get fever, we might get like a throat infection, we might get chest infection as well. So this is how it works. Air conditioning is very important in our like respiration or respiratory system. Then comes the sesamoid bones. They are small bones that can be present in tendons or the joint capsules. For example, the one of the biggest sesamoid bone is present in front of our knee, that is called patella. You can see it can this bone can easily be moved because it is present in the tendon of the joint. So there are accessory supranumerary bones that sometimes are present and mostly not present. They can be developed in different type of joints. Like if we have bones in our skull that are joined together like this via stiff joints. So sometimes during development there might be like small bone can be developed in that joint. So this is a illustration of the bones. This one is long bone. This is patella, like sesamoid bone in front of our knee. This is the skull bone, which is flat. This is a short bone. And this is irregular bone. This is one of our vertebra from our spinal column. So there is developmental classification as well. We will not go into the details so far for the scope of your lecture. We will discuss how usually they develop. So basically three types of development of bones basis or on the basis of development. First one is membranous bones, then cartilaginous, then membranocartilaginous. Let me tell you about the cartilage a little bit. Cartilage resembles bone, but is kind of very soft, and it usually present at the tips of the bones. Uh, you might have noticed if you're non-vegan and you like eat there is when you like take the muscle off from the bone, and you might see the shiny part at the end of the bone is called cartilage part of the bone. So membranous bones mean first they're like let me show you how. So membranous bone develops like this. First develops a little membrane, and then the bone develops inside of that membrane. So this is called intramembranous development of bone. Then there are cartilaginous bones. Our most of the bones are cartilaginous because when in the child or in infants, the bones are made up of cartilage, which I said is like soft, kind of soft bone. So, for example, this is made up of cartilage, and this is kind of soft, and this is a bone of like a 2 year old. But as we develop, as we grow older and older, and mostly when we reach the age of like 18 to 20, then what happens is exactly this whole bones gets calcified. There is more deposition of calcium and protein called collagen. Then this bones gets solidified. So this is called cartilaginous development of bone. This was membranous and this was cartilaginous. In this one, we already have a membrane and there is bone developing inside of the membrane. But in this case, there is already developed bone with a cartilage, but we are replacing the cartilage with a solid tissue now. So this is called cartilaginous bone development of cartilage. Sorry, this is called the cartilaginous development of bone. Then there are membranocartilaginous bones that are kind of in between. Let's take examples. Intramembranous bones are bones of vault of skulls and facial bones. So these are mostly intramembranous bones, and they develop during the like during gestational age, during the fetal age. So they develop inside the membranes. And meanwhile, the cartilaginous bones, once a child is born, most of the bones of the child is made up of cartilage. But as the child grows, ossification starts. Ossification means thickening as well as like deposition of calcium and other salts to make the bone more thicker and stronger as the child grows up, depending on his or her needs of like physical activity. Then membranocartilaginous bones, partly in membrane and partly in cartilage, which means like a part of them is made up in the membrane, and then as they grow, they might get calcified and show characteristics of cartilaginous bones as well. So examples are clavicle, mandible, occipital, and temporal. So occipital bone is the back side of our head. Temporal bone is like this one, this where we usually get a headache or temporal headache. This bone is called mandible, and there is clavicle like this bone, collarbone, which we say. So these four are membranocartilaginous bones. So these were the classification of bones on the basis of development. Now we move to the parts of the young bone. So basically, there are like two or three main parts. We will not go into the very in depth of this detail. Like it is very complex subject, or like complex topic, which is taught in great detail in medical syllabus. But as we are reading this topic or learning this topic as we in so far as our scope of this lecture is, we will go to the superficial details of the anatomy of skeletal system. So let's go with the part of young bone. So there is epiphysis. then there is diaphysis, and there is metaphysis. Let me tell you what these are and what is their function. So this shaft of the bone is called diaphysis, and this small part is called metaphysis. This one, just below this head or bulge, this is called metaphysis. And meanwhile, this end of the bone as well as this end of the bone is called epiphysis. So what happens exactly is this metaphysis part of a, bone of a young child has cartilage. As they grow, the cartilage extends in the sorry, let me show you how. So, for example, this part of metaphysis has cartilage, which is soft bone, sort of, and this all part of bone is hard. So, as the child grows, this part grows and adds to the bone. And in the same case here as well. So, this makes the bone length greater as we age in our teenage years. So whenever we reach the age of 18 or 20, or there are different age brackets in different populations as well as gender based classification as well. So the usual age of seizure of bone growth is 18. So what happens as we grow more than 18 or 20 or more than 20? So this metaphysis part of bone gets also calcified, which means this soft part of the bones gets replaced with the main bone or hard bone, which means this bone will not grow any longer. So the growth ceases here. So no matter whatever height you have got till 20s, it will not go further unless there are now surgical interventions available for the growth for the bone enhancement or height enhancements. But naturally, the bone growth ceases at 20. So this was the epiphysis, which makes a joint of the bone. Let me get the pointer. This was the epiphysis, which makes the joints with other bone. This was the metaphysis, which acts as a growing plate of the bone. And this is the diaphysis, which is the main shaft of the bone and acts as a mechanical support of the bone. Then there is blood supply of the long bones. Uh, yes. Okay. So there are different type of arteries. There are arteries and veins in our body. Basically, the arteries take blood from heart to the periphery of our body to carry oxygen and nutrients. Meanwhile, the veins carry blood from our peripheries, like from hands, our as well feet, toward the heart, and that blood is deprived of oxygen as well as it carries nutrition. Metabolic wastes. So, how does bone gets its nutrients as well as oxygen supply or whatever it needs? So basically, there are different type of arteries. The main artery is named as nutrient artery. How does it enters in the bones? There are small, very tiny holes in the bones. During development, these arteries just like pop in. So whenever the bones grow larger, these holes stay consistent with the blood flow. So that the blood flow will not be halted, or the artery might not be get compressed. So these artery gets in and then branches out to give blood supply throughout the bone. Let me tell you another part of the bone. This outer part of the bone is called cortex of the bone, and meanwhile the red part is called medulla of the bone or medullary cavity of the bone. Okay, there are different type of cells in the bone tissue. Now we are going to talk about like how the bones are made, what is present in the bones, and what makes the bones, and how the bones maintain themselves, and whenever there is a fracture, and how bone gets manages to repair itself. So let's see, there are four type of cells: osteoblasts, osteoclasts, osteocytes, as well as osteoprogenitor cells. So let me get an overview of that. So osteoblasts are basically the cells that are found in abundance in the bone. These are the cells like they are uh, these cells make up the bone matrix. Bone matrix means the actual hard part of the bone, the calcified part of the bone. Then there are osteoclasts. These cells are these cells function exactly opposite to the osteoblasts. So these cells make the bone. Meanwhile, these cells dissolve the bone. So why does these cells dissolve the bone whenever there is uh, decrease in calcium levels in our body? These cells start to like dissolve the bones and release the calcium in the blood. Plus, whenever there is a fracture, bone manages to heal itself. Plus, if there is irregular margin of the bones, so the osteoclasts do their job and make the bone surface even. Then there are osteocytes. These are mature cells, mature bone cells that get trapped in the matrix of the bone, which means there are calcium deposits, and in some between the calcium deposit, there are cells present in the bone that are called osteocytes. These are mature bone cells. Then there are osteoprogenitor cells. As the name signifies, these are sort of stem cells that are present in the bone, and these cells are can like multiply to as per need to give away, like if there is a need to osteoblast and these cells multiply and get turned into the osteoblast, if there is a need of osteoclast and these cells just divide and like give away osteoblast. So this is the function of osteoprogenitor cells. Next are joints. Okay, so there are different type of classifications on the basis of like their movement, their axis of movement, the structure of the joint. So we are going to look into it in detail. So whenever the two or more bones meet, they form a joint. It can be movable or it can be immovable or partially movable. So we are going to be discuss which type of joints are movable and which type of joints are not movable at all and how they are made. Okay. So there is structural classification as well as their functional classification. On the basis of structural classification, there are fibrous joints, which means there are just fibrous connection between two bones. They are mostly immovable joints. Then there are cartilaginous joints. As I said, our mostly long bones have like cartilage, and these joints are slightly movable. Then there are synovial joints. These are actively movable joints. Like there is this end of the bone, then there is a cavity of another bone, and then this forms a synovial joint. What happens exactly when they move? Like if it move, it have to move like this direction, and this cavity moves like this. Bone moves in this cavity like this. So what is example of this kind of joint? Our elbow joint. We can move like this in this direction as well as this direction. So this is a synovial joint, as well as our hip joint is also synovial joint. So these three main classes are of on the basis of structure classification. Then there is a functional classification. We will not go much into this detail, but there are synarthrosis, amphiarthrosis, and diarthrosis. They are mostly on the basis of like the move type of movement they allow. For example, some joints uh, allow movement in on one axis. For example, this elbow joint we have, this joint only allows movement into this direction. We can't just turn elbow like into right as well as into left. Whenever we want to move our hand in the right direction, meanwhile we have bent uh, our this joint. So this joint moves to help it. Okay, but this joints only get to move in this direction. So this is uniaxial joint, which means one axis of it. This joint allows axis movement on one axis. Meanwhile, this is multi-axial joint. This one, our shoulder joint, it allows movement in multiple directions on multiple axes. So what are fibrous joints? Fibrous joints are basically the joints that are like two bones are just connected with the help of fibers. Fibers are made up of collagen protein. So these are just like joints. They get once they are made and they just stay there. They doesn't allow any kind of movement. So this I have added this diagram for better clarification. So our all the bones in our skull have fibrous joints. So when does it develop? In early stages of life or in infant stage or in fetal stage, these fibrous joints have like mobility. They are like kind of mobile and they are a bit flexible. But because as we grow from our childhood, like from early years of life to the like early teenage years of life or teenage years of life, these our brain get to grow larger. So these bones like also grow a bit larger and they are a bit flexible to accommodate the growing brain. So when the brain is grown to a specific size of an adult, this flexibility of the joints gets like ended. So these bones or sutures, fibrous joints are also called sutures. So these sutures get stuck like this. So they do not allow any movement further. So whenever any person gets their skull surgery or brain surgery, the doctors get to remove these sutures and they just remove the suture and pick the bone and then do the surgery and place back the bone again. So this is how they operate on the brain by removing the fibrous joints of the bone. Then we have cartilaginous joints. Then we have synovial joints. We already discussed these in great detail, like synovial joints of multi-axial or biaxial or uniaxial. Then there is functional classification, synarthrosis, amphiarthrosis, and diarthrosis. As I said, that these are the joints on the basis of the mobility they allow. Synarthrosis, they are the joints that doesn't allow any movement. Amphiarthrosis, slight movement. Diarthrosis means freely movable joints. So previous classification was on the basis of structure. Meanwhile, this classification is on the basis of function of the bones of the joint. Sorry. So this is the main part. And this is the more clinically relevant we might like come across in our daily life. So these are the different type of diseases that are associated with our skeletal system. So we will see them one by one in great detail, and then I will take your questions. So the number one is achondroplasia. Then there is rickets, scurvy, herniation of disc. There is rheumatoid arthritis, and there is osteoarthritis. Okay, the first one is achondroplasia. Achondroplasia is mean there is some sort of uh, endochondral classification error. Sorry, ossification error. As we have studied, there are like intramembranous ossification or intramembranous development, and there is cartilaginous development of bone. So achondroplasia means there is some sort of error in cartilaginous development of the bone. And in this case, mostly our cartilaginous bones are our limbs. So in achondroplasia, the person's limbs are affected. He or she might have the trunk that is normal, but they have very short limbs. Okay, you might have seen that kind of person. So it is a transmitted as Mendelian dominant character. So it is sort of it might be a familial disease. It can be inherited in some cases. So then there is rickets. Basically, rickets is deficiency of vitamin D. And what happens when there is a deficiency of vitamin D? The calcification of cartilage fails. Basically, the vitamin D speeds up the process of calcification. If there is no vitamin D present in the body, the calcification of cartilage fails, which means the bone, that all the developing bones that are kind of very brittle, that can be easily broken, and the bones are weak in the rickets, and they might also get like bored. In some children, like children of rickets, so these are, for example, straight bones in the normal person. But if there is rickets, the bones are soft and they are least calcified. There is not enough calcium. They're soft. Then they get bent like this. So in a person of rickets, they have might have bent long bones or weight bearing bones that might get bent due to the weight. So then is the next one is scurvy. Scurvy is basically deficiency of vitamin C. It is also important in the formation of collagen fibers. Basically, collagen is a protein in our body, and it is a very important component of our skin as well as other connective tissue like soft part of our body. So whenever there is a deficiency in vitamin C, which means our collagen is not properly formed, which means our bones meshwork is not properly formed, which leads to like inappropriate or like I would say there is no proper collagen, which means there is no proper cementing of our bones. You get it? Like if we have a proper mesh, we can only trap calcium in that mesh. If the mesh is already malformed, we cannot trap the cement of our bone, which cement of our bone is called like different sorts of the calcium. Uh, if there is vitamin C deficiency, there is no proper collagen, there is no proper meshwork, there is no proper cementing of our bone. So which means there is no proper formation of the blood vessels as well as the bone might squeeze the vessels. Plus there is like there might be uh, improper structure or underdeveloped bones as well. So whenever the capillaries might get ruptured in this kind of patients in severe scurvy, they might have hematomas in the blood in the bones as well as muscles, which means they might their small blood vessels that are called capillaries, they might burst open and they form like uh, clotted blood in their bones as well as in their muscles. So this is a very severe form of scurvy. So vitamin D and vitamin C is very important for the bones and as well as our soft tissue of body. Then there is herniation of disc. Many people get this as like due to different type of exercises. There might of different due to posture might get it due to uh, wrong posture. Some people might get it due to like during the lifting of heavy weights. So what is herniation of disc basically? Let me demonstrate a little bit. For example, this one is our vertebra and this one is another vertebra of spinal column, and these are the margins, and there is a disc present like this one in between the vertebra. Sorry, I'm not good at drawing. So whenever there is a malposition of disc, this just bulges out like this from intervertebral space. This is the vertebra number one, this is the vertebra number two, and this is the disc present between the two vertebra, and this disc just slips away sometimes and it compresses nerves, which causes severe pain in our legs, which is called sciatica. If that pain like radiates to the lower limbs, it might be like localized pain in our lower back. So this is caused by the herniation of disc. The treatment of the herniation disc is like sometimes we do physiotherapy, we might there is might need of like chiropractor techniques. There might a great need of like bed rest on a flat surface. So this is how we treat herniation of disc. But in severe cases, if the disc is misplaced as well as ruptured, so there might be a surgical intervention that can correct this situation. Okay, moving on with the arthritis. Basically, the joints are also called arthrites. So whenever we call arthritis, which means the inflammation of joints, it can be due to any reason. So there are basically two types of, this is a basically like a broad classification. There might be a classification further inside, but we are going to deal with the rheumatoid arthritis as well as osteoarthritis. So rheumatoid arthritis is sort of inflammatory disease in which our own immune system like destroys the synovial membranes or like the bone surfaces that form the joint. So the bones start rubbing with each other because their surface gets destroyed. That leads to arthritis. That specific type of arthritis is called rheumatoid arthritis. So this type of arthritis has specific symptoms like morning stiffness of the joints of these fingers. This is how we diagnose the rheumatoid arthritis from osteoarthritis. The osteoarthritis means there is degenerative condition of the weight bearing of joints, weight bearing joints, which means osteoarthritis is usually a disease of old age, which means as you grow older and older and older, so as you reach my 60s or 70s or 80s, your body is not like capable of making that much of youthful uh, frictionless fluid between the bones and the smooth surfaces of the bones. So eventually that cartilage erodes away, which means the bones start to have friction between them, and whenever they rub or whenever the elderly person starts to move, uh, they have a great deal of pain in their weight bearing joints. They might have severe pain in their like hip joints. They might have severe pain in their knee joints. They might have severe pain in their ankle joints. So, which means they in osteoarthritis, the main joints that get affected are the weight bearing joints, and it is a mainly degenerative disease of old age. So, on the basis of like definitely, there are ways to prevent these kind of arthritis as well as other bones. We can like avoid it by proper supplementation or with a proper diet, like uh, that might have calcium rich, that have vitamin D rich and vitamin C. So plus to avoid arthritis, we might start like mobilizing our joints more in our youth. Even our middle age, it is very important to do a like even light exercise or do a walk or do a run uh, to keep our joints moving, and they know that that person is utilizing us well, so they just do not like rot away and start rubbing bones with each other. So arthritis is kind of we just have to uh, keep our mobility, and we have to might supplement as well to cope up with the situation. But in severe cases of osteoarthritis as well as rheumatoid arthritis, there are different type of medical as well as surgical treatments available. People get hip replacement, knee replacement in case of osteoarthritis. In case of severe osteoarthritis, in which bones are completely eroded, so people go for arthroplasty, which means the joint replacement of the affected joint due to the arthritis. And in osteoarthritis, there are certain type of medical drugs that we give the patient to deal with. Plus, there are steroid drugs that are anti-inflammatory. Some people use as in anabolic steroids to like grow their muscles as well as but in this case of diseases like arthritis, we might inject the steroids directly in the joint to like to alleviate with the inflammation, because steroids are the only known drugs other than the painkillers that stop or reduce the inflammation of the joints. So this is how we like improve the quality of life in elderly patients that are bedridden or that use wheelchair, and they do not like are not able to mobilize anymore due to the arthritis. So this was all about arthritis. Now